Hi, my name is Nicole and I did my presentation on MRSA. So, what is MRSA? MRSA is an infection that's caused by a type of staph bacteria that's resistant to antibiotics. MRSA is difficult to treat due to its resistance to common antibiotics, and the main risk factor for MRSA is broken skin, such as abrasions or incisions. So, how's MRSA spread? MRSA is spread by contact with infected people or objects that are carrying the bacteria. In the community, MRSA is spread via contact with contaminated wounds and sharing of personal items that have come into contact with infected skin. In healthcare settings, MRSA is spread by direct contact with an infected wound or from hands contaminated with the bacterium. Staph infections, including those caused by MRSA, can spread in hospitals, healthcare facilities, in the community, workplaces, and schools. Interestingly, the opioid epidemic may also be connected to the recent increase in staph infections. People who inject drugs are 16 times more likely to develop a serious staph infection than those who do not. So, who's at risk for MRSA? MRSA can occur in two very different settings, and therefore the risk factors for each setting differ. In healthcare, risk factors include being hospitalized, particularly older adults, but approximately 5% of US hospital patients carry MRSA in their nose or on their skin, having an invasive medical device such as IVs or catheters, which provide a pathway for MRSA to travel into the body, or residing in a long-term care facility. In community settings, risk factors for MRSA include participating in contact sports, living in crowded or unsanitary conditions, men having sex with men, having an HIV infection, or again, using illicit intravenous drugs. So, when's MRSA contagious? The incubation period of MRSA is variable. Symptoms typically appear between 4 and 10 days after exposure to the bacteria. And the MRSA is contagious for as long as the bacteria is present in the nose, throat, and mouth secretions. Symptoms of MRSA vary depending on the part of the body that's infected. Most infections appear as a bump or visibly infected area that may be red, swollen, painful, warm to touch, full of pus or other drainage, and accompanied by fever. To test for MRSA, a tissue sample or nasal secretion is collected from an individual suspected of having MRSA, and the samples are sent to a lab for testing. The sample is placed in a petri dish with nutrients to encourage bacterial growth. Traditional staph tests do not provide results for several days, as it takes approximately 48 hours for the bacteria to grow. But there are newer tests becoming available that are able to detect staph DNA within hours. And testing should be performed in locations where one or more cases of MRSA have been confirmed via laboratory test, and test close contacts of individuals with a known infection to help detect and control potential outbreaks. So, how can we prevent MRSA through sterilization? So, it can survive on some surfaces for hours, days, or even weeks. And they can spread to individuals who touch contaminated surface. So, surfaces that have frequent contact with bare skin, particularly those that could come into contact with open wounds, should be the main focus of sterilization efforts. So, you'd want to use both cleaners or detergents and disinfectants on the surface. The EPA provides a list of products that are effective against MRSA, and then obviously washing hands frequently will help prevent the spread. So in healthcare workers, staff should wash hands with soap and water or use hand sanitizer both before and after coming into contact with each patient. Ensuring that rooms and other items have been sterilized will also help to keep the staff safe. And then educating on and using contact precautions in healthcare settings will help slow the spread. And then always the testing of healthcare workers will help prevent MRSA from spreading. So, why is MRSA important? In the community, infections can be acquired in a variety of situations and environments. Serious cases may cause pneumonia and other infections. If left untreated, MRSA infections may cause sepsis, and then obviously antibiotic resistance makes MRSA difficult to treat. In healthcare settings, patients are very susceptible to infection due to weakened immune systems, and MRSA can cause severe issues. And then MRSA infections can be prevented with awareness and strategic prevention efforts. Just a couple other considerations. Methicillin-resistant staphylococcus is one of the most accessible modern pathogens. It's a leading cause of a variety of infections, such as bacteremia, endocarditis, skin and soft tissue infections, and more. And then in some regions of the world, MRSA still poses a large clinical threat with high rates of morbidity and mortality in clinical settings. So in summary, MRSA is an infectious disease that can be found both in the community and in healthcare settings. Its antibiotic resistance makes it hard to treat, and with proper precautions, MRSA can be prevented.